Hey everyone, thanks for joining. Of course, back here with David. Want to give people kind of a general update, but also get a lot of questions about other things Vaxil is doing other than COVID. So I wanted to kind of squeeze it into a video, talk about other things Vaxil does. But first things first, David, how are you?
Hey, Jason. Morning. Doing great, thanks. How about you?
Yeah, good, good. No, things are awesome over here as well. So cool. Well, here,
Good.
jumping into it, I know you wanted to kind of give a general update on kind of where Vaxil is, how things are going.
Sure. Yeah. We don't have specific updates on the experiments we talked about in the last press release. Just want to set expectations there. But we are continuing and pursuing all the different work that we said we would do. So we've begun the experiments in terms of all the steps that are necessary to get going across the different areas that we said we would work on. So optimizing the different aspects of dosing regimen, the intervals of injections that might be given to see how we generate the optimal immune response. And that work will be relevant for us across all the different areas that we work in. So, of course, relevant for COVID, tuberculosis, other infectious diseases, and also, and maybe most importantly for us in cancer. So that work is ongoing. Of course, we said we would begin the work on oral formulation, on validating what we saw in the initial study. So that work has also begun in a variety of ways. We have our own work that we're doing, plus we continue to look at various ways of partnering with oral technology so that we can keep that moving. So we're working across all of those different areas, Jason, and we've gotten a bunch of different questions from investors about that. We don't expect to have news to report in the short term. I'm not able to yet give a timeline for when we will, but as we develop the programs and get into them more, we'll report back when we have material news to report.
Yeah. Hey, I think that was a fantastic update. Lots of things moving in the right directions, as expressed in the previous news release, which is awesome. So thanks for that. Here, kind of hopping into kind of, again, general video. Wanted to chat about things other than COVID that Vaxil does. I know a lot of people extremely interested in the COVID side and don't really know what else Vaxil does. Do you want to kind of give an overview?
Yeah, sure. Thanks. Great question. And yeah, we do get lots of questions about what's going on in the other spaces. So it's a good opportunity to talk about that. So Vaxil, generally speaking, works in infectious diseases and in oncology. That's where we see the biggest opportunities for the signal peptide platform that we have, the technology. In infectious diseases, we've advanced, obviously, in COVID, as you mentioned, also in tuberculosis. We've run experiments there, and we continue to look for the right way to advance the tuberculosis programs. There's a huge unmet need in tuberculosis. Part of that unmet need is in underdeveloped parts of the world where financing is an issue. So it's a challenge to find the right way to finance those kinds of studies. And that's really the biggest unmet need. So there is a vaccine out there for tuberculosis. It works in certain cases, and it works quite well. We've seen in some of our studies that our technology works as well in tuberculosis. So we think about a bunch of different opportunities in TB. One of them would be to take our technology into the space where the current standard of care does not work or does not work as well. We also look at using our technology as a treatment for tuberculosis. So once somebody has the disease, there are ways to use signal peptides to treat tuberculosis, we believe. So we're looking at all the different angles there as our technology alone and our technology in combination or as a boost to the standard of care. Vaccine, there's the BCG vaccine out there. Treatment is usually with antibiotics. So our signal peptide technology could be used as an add-on or a boost to those technologies, both for prophylactic, for vaccine type, or also for treatment. So that's an important place. We do, of course, look at other infectious diseases. We've got programs where we're exploring them through our Vaxhit platform, which is our bioinformatics platform. We've done a bunch of work on that platform over the last few months to make that work more efficiently, so that we're able to discover new targets faster. So that's another area for longer term planning that we have in play. And then in oncology, where we have the most advanced program, we have our product called Immucin, which is otherwise called VXL 100. That's a signal peptide that's been tested in clinical trials in multiple myeloma, where we see good safety. We had a phase 1/2 study done a few years ago. We think that the signal peptides are most relevant in solid tumors, so that's the direction we're taking. We did announce the collaboration that we have with Ben Gurion a while back. That collaboration is moving forward, where we're exploring different applications. We'll be doing some animal studies there around different aspects of oncology, both using the technology, the polymer technology, which has great promise that we now have in licensed from Ben Gurion, but also using our Immucin and using them separately, but also using them in combination. So that's a fairly significant study for us, a big study, where over the next period of time, we'll start to hopefully see some good results there. And that will open up a variety of opportunities for us to explore, again, alone and or in partnership with other companies. We're also doing our own work with Immucin to explore different aspects of solid tumors. So there are well-known studies done on where MUC1, which is the target of Immucin, where MUC1 has its most significant impact in cancer. So those are tumors like lung cancer, breast cancer, ovarian cancer. There are a bunch of them. It's a well-known target. NIH has actually acknowledged that MUC1 is a high priority target. No one else seems to be doing it with signal peptides, so that's our unique value proposition. People are looking at it in a variety of different ways, but no one else seems to be doing it with signal peptides. So we're encouraged both by the opportunity to have impact on patients here in general because of the MUC1 approach, but also specifically with signal peptides, where we have the unique value proposition and the ability to help patients. We saw signals in that clinical trial. We saw signals of good immune response, so we think the opportunity is significant there. And it's also potentially most significant because since we've already been in a clinical trial, our path to a clinical trial with that product can be faster than it would be with new signal peptides that we might formulate. So that's kind of a general overview of how we're progressing and how I see the landscape. I will add one other point because we've received some comments about this. Obviously, cancer is a prime therapeutic area for pharma companies, big and small. It's obviously a huge unmet need. Cancer is probably not, we shouldn't think of it as one disease, but a whole range of diseases. The fact that so many companies are pursuing treatments in cancer, preventative and also therapeutic, is not a reason for us to be concerned or afraid. It's certainly a reason for us to be concerned in a good way, in the sense of, optimizing our approach. Potential partnerships can be very rich there because the opportunities can be rich because there are so many companies looking, and companies are trying big and small. Merck actually just submitted, Merck just submitted an application to the FDA, for instance, for Keytruda, which is a very effective therapeutic in a whole variety of cancers. They just got rejected by the FDA for triple-negative breast cancer, for example. So even though lots of companies are pursuing these targets, and Keytruda is extremely successful across many of the different cancers, here's an example where they thought they'd be successful and the FDA said no. Now they may go back and have another shot at it. Merck's a great company. I'm sure they'll make this work somehow. But these are opportunities that everyone is pursuing, and some will succeed. Relatively few probably, and many will fail. So I think that the opportunities are still great in this area. Cancer will continue to be a huge unmet need across the different tumor types and targets. And I think we have a great opportunity to help people there and make a big difference for patients.
Wow. Well, thank you so much for for the huge overview. Obviously, pretty incredible. Really makes my head kind of run on what are going to be some other videos we can do about different parts in that. I know it's a lot for anyone who's listening to take in, but I do ask if you have questions that you want to see, you want to ask, that we can put into another video. Please let us know. Email or in the groups are fine. David, thanks so much for the kind of general overview. I know you even kind of talked about what you're working on now, where things are going. Of course, we can do a bigger dive into some of these alone in a different video. But is there anything general, Vaxil related, not so much COVID, that you wanted to chat about?
I think just my last point that I made before, I just want to emphasize again, the opportunity in cancer is very significant. The need that's unmet there, the patients who are suffering is a huge unmet need for our ability to help patients. And given what we saw both in our preclinical work and also in our clinical study, we're excited to be working in this space. So we think we can make a big difference for people here. And we appreciate the investors who are helping us to be able to do that, and your patience, of course, because this does take time. So thanks everybody for sticking with us.
Awesome. Well, thank you anyone who made it this far. Again, any questions, please let us know. David, thanks so much for doing that general update at the beginning as well, and kind of the big overview for Vaxil. But looking forward to chatting again soon.
Excellent. Thanks a lot, Jason. Take care.